is Lena Hall. I am a family nurse practitioner student, and I am doing the neurological exam, and I will be demonstrating the cranial nerves. The first cranial nerve is the cranial nerve 1 is olfactory, and I will first be assessing, checking the nasal patency and sense of smell. So I want to make sure you can smell. Take a deep breath in. Thank you. And I will be placing one scent under your nose and occluding the one side and placing the scent, and you tell me what you smell.
Cinnamon.
Okay. Now the other side.
Coffee.
Okay. Excellent. So moving on to patient's sense of smell is intact. Now moving on to cranial nerve 2, which is the optic nerve. I'll be testing the visual acuity in both eyes and at the same time, and then each eye individually by using the Rosenbaum test. So go ahead and tell me what the lowest number you can lowest line you can rate on that test.
LTFPH.
Okay, cover one eye.
LTFPH. LTFPH.
Excellent, thank you. Now, next I will be testing the visual field acuity. So I will do visual field screening, and I will be wiggling my fingers on the outside and tell me when you can see them.
Yes.
Okay, excellent. Next, we're going to inspect the optic fundi and the optic discs. So I will be 15. Arteries, veins are intact on the nose, on the eyes, and red eye was observed. No papillary in the eye. Next, we'll be moving on to the cranial nerve 2, the optic nerve, and cranial 3, which is the ocular motor nerves. So I will be assessing the shape, size of the pupil. So go ahead and look straight ahead. Pupils equals round reactive light combination. Pupils were approximately 2 when the light hit them, and they went back to 3 after the light was away from them. They were so now I'm going to test your near reaction. So I'm going to hold my pen light 10 centimeters from your eye and ask you to look at it alternately from my pen to something in the distance. Next, we're going to test the cranial nerve 3, the ocular motor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is the abductions, the extraocular movements. With this, you're going to follow my pen light. When I'm going to be drawing an H, and don't move your head, just move it watch it with your eyes. Okay, good. I also would be assessing the patients for, look straight at me, and I would be assessing the patient for nystagmus, which would be the rapid movements with the eyes when they're sitting still. Next, I will be testing the cranial nerve 5, which is the trigeminal or the motor. So I'm going to press on the temporal and masseter muscles, and you're going to clench your teeth. Good. Next, I'm going to test for the sensory, which is a light sense sensation on. So I will be taking a cotton and a wisp of cotton, and I'm going to. You tell me if you feel the soft sensation.
Yes. Yes. Yes.
Okay. And then your jaw. Well, it's hard to get a beard.
Yes.
But next, I'm verbalizing this. I'm not going to do it, but I would be testing for the corneal reflex, where I would approach from the side and I would lightly touch the cornea with a fine cotton wisp as the patient looked up and away. So that side and that side. Next, we're going to assess for cranial nerve 7, which is the facial. So I'm going to have the patients raise their eyebrows, close their eye, right, hold on one second. Raise your eyebrows, yep, go ahead. Close your eyes as hard as you can, pinch, 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 okay. Show me your teeth. Smile, puff out your cheeks. Okay, good. Now, as I was doing this, I would observe the patient's face at rest and during conversation, but then as I would assess all of those as the patient was able to do all of those. So cranial nerve 7 is intact. Next, we're going to test for the cranial nerve 8, which is the acoustic, the vestibular, and I'm going to assess your hearing. So I'm going to occlude one side of your ear and whisper, and you're going to tell me what you hear.
1, 2, 3. ABC.
Okay. Next, we're going to perform the Weber and Reiner test. First, I'm going to do the Weber test, which I'm going to strike on my hand and go above your head, and you're going to tell me when you can hear it and when it stops, okay? And if it's equal on both sides that you hear it. Is it equal on both sides?
Yeah.
Next, I'm going to place the tuning fork on the back of your ear, and then when I move it forward, you're gonna tell me when you stop hearing it in the back, and then I'm gonna move it forward, and you're gonna tell me, okay?
Okay. 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 Okay.
Alright, your hearing is intact. Next, we're going to assess cranial nerve 9, which is the glossopharyngeal, and the cranial nerve 10, which is the vagal. So in this, I would be listening to voice quality, and I'm going to I'm going to look at your soft palate and your pharynx. So go ahead, say, how are you?
How are you?
Okay, go ahead and open your mouth. Stick your tongue. Say, ah. Palate moves up and down, as patient's saying, and palate is intact. Next, I am verbalizing that I'm doing this, but I'm not going to do it. It is assessing for the gag reflex. So I would warn the patient what I was about to do, and then I would lightly touch the back of the throat with the tongue blade. And I'm only verbalizing that. I will not be doing that today. Next, I am assessing for cranial nerve 11, which is the spinal accessory. So I'm going to place my hands on the patient's shoulders and have you shrug up big. Okay, tighten your, good. Alright, and then you're gonna feel my hand on your face and push against my hand with your head. Okay, turn your head, other way. Okay. Alright, and I felt resistance on both of those, so cranial nerve 11 is intact. Next, we're going to assess for cranial nerve 12, which is the hypoglossal. It's would be assessing for fascicillation, symmetry, deviation, movement, and strength of the tongue. So I'm going to inspect the tongue. Okay. There's no deviations, no swelling, it's pink. And then I'm gonna have you stick your tongue back out. Move it side to side. Okay. All right, cranial nerve 12 is intact. And that is all of the cranial nerves.